Hello.
Hi.
Hi, my name is Esther and I'm your nurse today and I'll be performing a head to toe assessment. I'm going to go ahead and provide privacy. So provided privacy. I check the doctor's orders and again I have to perform a head to toe assessment. I want to confirm that I have the right patient. Let me go ahead and perform hand hygiene. Okay. I'm going to check your armband. May you please confirm your name and date of birth?
Astrid, December 3rd, 1999.
Okay, great. Do you have any allergies?
No.
Do you feel any pain?
No pain.
Okay, great. The information you provided did match up with the orders. Okay. Do you know where you are today?
My friend's house.
Good. Do you know what time it is?
Around 8 p.m.
Good. And do you know who the president is?
Biden.
Okay, good. The patient's alert and oriented times 4. Okay, so let me go ahead and start off by doing the HEENT, which is your head, eyes, ears, nose, and throat. The first step is to visually inspect you. I'm looking at your head. The shape is normal and is symmetric with your body. There's no lumps, lesions. I don't see dandruff. I don't see any bugs or critters crawling throughout your hair. Your hairline is full and normal. I don't see any patches. The hair on your face is normal. Your eyebrows are full, no patches in your eyelashes. I don't see any drooping or edema. And your skin tone is within normal limits for your ethnicity. And I don't see any lesions or lumps around your mouth, eyes, or nose. So that's good there. So I'm going to go ahead and check your eyes. I'm going to be looking at your pupils. And I'm looking at your, to check if they are reacting well to the light. As far as your eyes goes, when the light flashes, they're going to constrict. When the light's away, they're going to expand. Okay, I don't see any discoloration in your eyes. Your pupils, cornea is clear. I don't see any jaundice. They are white. They're your eyes are moist. I'm gonna go ahead and pull down your eyelids. They are pink and moist. No dryness. Do you wear glasses or contacts? Okay, great. Go ahead and perform hand hygiene again. Okay, I'm gonna check your nose. Do you have any history of nosebleeds?
No.
Okay, great. No lesions, pink and moist. Nose, mouth. Okay, I'm gonna have you open your mouth. I don't see any sores, no cracked teeth. Do you wear any braces?
No.
Okay, great. Your mouth was pink and moist. And I'm going to check your ears. I'm checking to see if there's any unusual discharge. No lumps, lesions within normal limits. No lumps, lesions, or discharge from your nose or your ears, which is good. I'm also going to perform something called the whisper test, and that's going to check your hearing when it's occluded. I'm going to have you, I'm going to repeat some words, and I want you to repeat it as your ear is occluded. Okay, yellow, pink, green.
Yellow, pink, green.
Perfect. You are awesome.
You are awesome.
Okay, great, good job. Okay, so as far as that goes, now I'm going to be checking your lymph nodes. You have a series of lymph nodes that I'll assess now. Okay, so this is the preauricle. Do you feel any tenderness? Okay, posterior auricle. Okay, submandibular, submental, the occipital, jugular gastral, and then I'm going to check your cervical, and this is your deep cervical chain. Okay, and then I'm going to check the subclavicular. Okay, did you feel any tenderness when I did that?
No.
Okay, do you feel any pain in your neck as I feel here? This is your thyroid.
No.
Turn to the left, turn to the right. Okay, I did not notice any jugular vein distension. I want you to open and close your mouth. open and close. I'm gonna have you do that again. Close. No clicking of the TMJ, so that's good. Okay, so now I'm gonna go ahead and assess your cranial nerves. We're gonna start off by the olfactory, which is your smell, and I want you to tell me what this smells like. Okay, great, good job. And then I'm going to assess your visual fields, and that's going to check the oculomotor, adducens, and the trochlear. And I'm gonna have you follow my pen here. Okay, good. I don't notice any nystagmus or unusual involuntary movements of your eyes. The optic nerve is 2, and we assess that by using the Snellen chart, which we did earlier. And I'm going to check your trigeminal nerve by using this cotton, and I want you to tell me if you feel them.
Yes. Yes.
Okay, good. Perfect. Okay, good. And as far as your mouth, I want you to frown. Okay, and raise your eyebrows. Good. Puff out your cheeks. Okay, so I did still assess the trigeminal. I assessed your facial nerve. I'm gonna have you open your mouth again, and I want you to say ah. Okay, great. Wiggle your tongue from left to right. Okay, good. So I checked your vagus nerve, hypoglossal, and the glossopharyngeal nerves. I'm gonna check the accessory nerve. I'm gonna have you shrug your shoulders. Good. And I'm gonna do it against resistance. Okay, perfect. Did you feel any pain with that?
No.
Okay, good. Okay, so I assessed all 12 cranial nerves, and now I'm going to assess your tissue integrity. Okay, so again, your skin is intact. It isn't dry. I'm going to check your skin turgor. Okay, there was no tenting, which means you aren't dehydrated. And no dry patches or itchiness. And let me check your capillary refill. Okay, very good. They are 3 seconds or less. Check your hand here. 3 seconds or less for each of the fingers. Okay, I don't see your skin is warm and within normal limits. And now I want to check your mobility. And well, let me check your pulse first. So I'm going to check your pulses. I'm going to start with the brachial. I'm going to do them bilaterally. Bilaterally, they are +2, which is normal. And I'm going to check your radial. And bilaterally, they are +2, normal. And I am also going to check your popliteal, which is located in the back of your knees. Okay, they are +2, which is normal. Then I'm going to check the posterior tibialis. They are +2. And then I'm going to check the pedis, diastalis pedis, and it's +2. Very good. Do you feel any numbness or tingling in your hands or feet?
No.
Okay, good. I'm gonna go ahead and perform hand hygiene again since I touched your feet. I'm going to go ahead and check your carotid pulse, and we're going to check one at a time, because if I were to occlude both, that would be would cause the blood flow to stop, and you could possibly pass out. Okay, and which is stopping the flow to your brain. Okay, so I did not feel any trill. Now I'm going to listen for bruit. I'm going to go ahead and sanitize before I begin there. Okay, so I'm listening for bruit in the carotid. No bruit. No bruit. Okay, that is good. And that was within normal limits. And then I wanted to check your mobility. So I'm gonna go and have you extend your arm out, up, down. Do you feel any pain?
No.
Okay, up, down. Good. Push out your legs, left and right. Good. I want you to push back on my hands. Okay, good. Let me try that again. Okay, strength equally bilaterally strong. And I'm gonna have you push up, and I push against you. Okay, good. Equally bilaterally strong. And good. As far as your arms, I don't see any swelling or protrusions in your elbows, shoulders, or in your knees. Do you feel any pain in those areas?
No.
Okay, great. Okay, I'm going to go ahead and perform hand hygiene again. Now I'm going to go ahead and I'm going to listen to your heart sounds. Okay, let me go ahead and sanitize this again. Okay, so I'm going to listen to your heart sounds. As far as listening to your heart sounds go, do you have any history of heart conditions?
No.
Okay, good. Because typically we would listen to you sitting, lying, and on the side. But since you don't have any history of murmurs, I'm going to assess you only sitting down. Okay. As far as the other positions go, they're good for locating murmurs. Okay, so I'm gonna start at the second intercostal space on the right side, and this is the pulmonic. The aortic. Okay. And then I'm going to listen on the second intercostal space on the left, and that is the pulmonic. Okay. And now, is it okay if I have you stand up? And I'm going to, is it okay to expose?
Yes.
Okay, great. So I'm just going to listen to the third intercostal space on the right side, and that's going to be the Erb's point, and the mitral, and that is considered the apex. And I'm going to listen for a full 1 minute, and while I do this, I'm going to be checking your respirations. Okay, I listened for a full minute, and your heart rate was 87, and your respirations were 18, which is within normal limits. Okay, I'm going to go ahead and perform hand hygiene again, and I sanitize my instrument. Okay, so Also going to now move on to gas exchange. I'm going to percuss your um, your lung fields before I listen, and I'm just going to check for any areas of dullness. Okay, okay, no dullness, no dullness. Okay, I'm going to check your posterior. Would you be able to stand up? Okay. Okay, so I percussed all the fields, and then I will auscultate your lungs now. There was no dullness. It was tympanic. Okay, so I'm going to listen for any adventitious sounds. Take a deep breath in and out. Good. Take a deep breath in and out. Good. In and out. Good. In and out. Good. No adventitious sounds. Now I'm going to listen to the posterior. In and out. Good. Good. Okay. And is it okay to lift your shirt from here?
No.
No?
No.
Oh,
It's okay.
Oh, it is. Oh, okay. Sure. I'm going to just put it underneath. In and out. Good. In and out. Okay, great. I did not hear any adventitious sounds. I'm going to go ahead and sanitize this here. Okay, and now I'm going to listen to the fremitus to check for any dullness. So I'm going to have you say, here, say 99.
99.
Okay, great. And then I'm going to have you say 99.
99.
Good, 99.
99.
99.
99.
Okay, I'm going to have you breathe in and out. I'm checking for your expansion. They are equal and bilateral. No unevenness. And okay, so I listened to your lung sounds, heart sounds. I did your HEENT, intracranial, and I am going to assess your abdomen now. Okay, so I'm going to have you lay down, and it is okay to expose your abdomen.
Yes.
Okay, good. I'm going to have you bend your knees. Okay, great. And before oh yes, so let me go ahead and perform hand hygiene again. Okay, I'm going to expose your abdomen. Okay, so I'm going to visually inspect your abdomen. I don't see distension or any protrusions. Have you been constipated?
No.
Okay. When was your last bowel movement?
This morning.
Okay, great. Okay, so so first we're going to go ahead and now I'm going to auscultate the abdomen, and we're going to start in the right lower quadrant, and we're going to listen for a few seconds, at least 5 seconds, before I check her again. I'm going to go ahead and sanitize the stethoscope again. Okay. I'm going to listen. In the clockwise direction. Okay, the bladder is normal. And now I'm going to palpate. Okay, so I'm going to palpate, and I'm going to use light palpation, which is 3 to
19.
4, 3 to 4, 3 to 4 centimeters, and I'm going to use deep which is 5 to 8 clockwise. I'm going to palpate your upper upper left corner for spleen, and your liver. Deep palpation to see if I feel your liver. I feel the edge of your liver, and I'm going to percuss. No dullness, no dullness, and no dullness, which indicates no inflammation of the spleen or liver. And do you feel any pain in your upper corners? Okay.
No.
So, okay, and her expansion as far as breathing goes is normal. It's unlabored. Okay, so I'm going to go ahead and lower your shirt, and I'll help you up.
Thank you.
You're welcome. And do you have any questions for me?
No, ma'am.
Okay, good. You did great. Your assessment was normal, and that will be the end of our assessment today. Thank you so much for having me.
Thank you.